Hello, welcome. We've made it to week 3 of our New Year Healthy Habits series. And this week, our entire goal is to look at evidence-based medicine. So let's get started. A quick review on what we've done so far in this series. In the past 2 weeks, we've introduced the 6 pillars of lifestyle medicine. You can quiz yourself if you remember what each of the 6 are. We also learned about SMART goals, and we've actually crafted and looked at some examples of some SMART goals ourselves. And hopefully you had a couple of minutes yesterday or earlier today to try and pick one of the pillars of lifestyle medicine and write down a SMART goal that you would like to commit to for a given period of time. And hopefully we've already put some of these goals and methods into practice in our own lifestyle. So this week, our goal is evidence-based medicine. So during our very first lecture, we talked about what evidence-based medicine is, but I want to do a recap. Evidence-based medicine incorporates research practice, clinical expertise, and patient values into really like a holistic approach to scientific knowledge. It reduces our reliance on anecdotal experience and outdated practices. So it really is like the most up-to-date practice, combining practice and clinical research into the patient experience. So it improves patient outcomes and it optimizes resource utilization. So our plan for the next 2 weeks is to formulate a clear question for each of the 6 pillars of lifestyle medicine using the PICO approach. And PICO is a mnemonic that's used to formulate clinical research questions, particularly in healthcare. It's a structured framework to create a focused question and identify key components that are necessary to guide searches in literature for specific evidence. So the P stands for patient, problem, or population. So what patient, what population, or what problem do we specifically want to look at? The I stands for intervention. So what treatment, what exposure, what are we looking at? So medications, therapies, lifestyle changes, that kind of thing. And then C, we skipped C. C is our comparison group. So is there a control group? What's the alternative treatment? So if the patient had an exposure in one group, the other group would be considered the control group. And then the O is going to be the outcome. So what are the desired effects that we want to see from this intervention? So it's kind of a framework that we use to evaluate the scientific approach. So we want to acquire evidence and appraise and assess pieces of evidence. So I'll keep this video today short and sweet because we will have a lot to work on for the next 6 days. Each day we're going to take a look at an article and we're going to kind of break it down. And each of those articles are going to tie into the 6 pillars of lifestyle medicine. So we'll look at some scientific research that really shows and proves that this lifestyle medicine approach is effective in improving health outcomes. So I'm super excited. Everyone have a great rest of your day, and I'll see you tomorrow.